A question? Yes, if there's a fresh question, otherwise I have some pre-programmed questions.
I need to know what an OG is, and I'm sure that O is old and I'm old.
Original gangster.
OG? Anyone know what OG is?
Original gangster.
Original.
Gangster. Oh. All right. And it just means the older people in the organization. So most of our staff.
When I thought of building healthy community,
Our staff, it's about 35 of us. Over half of us, I'm not including this, are under the age of 27. And I'm 42. So that gives context to OG. Arise OG.
I was thinking more hospitals, doctors, something.
Building healthy communities really means everything. It means building healthier schools. It means building healthier homes.
The place where you live, the place where you play, where you pray, where you work, where you go to school, has everything to do with your health.
Building Healthy Communities is an initiative that the California Endowment has generously agreed to invest in 14 communities to really help them create an environment that is healthy.
From 2009 to this moment, there have been a series of untraditional partnerships that have been formed as a result of the Building Healthy Communities work.
We're building stronger relationships that are pushing policies at the city level and at county level and even at the state level that we weren't doing before.
We're actually starting to see the fruits of our labor.
I'm just glad I was involved.
El reto es convencer a la demás gente.
How do we feel we should be portrayed?
Of how a community can come together to seek solutions.
You have absolutely changed Boyle Heights and LA Unified through your leadership.
La unión hace la fuerza.
We all have something in common. We all want better for our community or better for our kids.
Installed in 2 pilot locations, South Kern and the eastern Coachella Valley. The goal of the Agua for All is to increase access to safe drinking water and encourage kids to fill up empty bottles with water instead of soda.
I would like the Board of Supervisors to help us to stay healthy.
Undocumented immigrants may not lose access to specialty health care in Fresno County after all.
The group calling itself the Fresno Building Healthy Communities asks city leaders to make an investment in more and better parks throughout the city.
Skateboarders came together in City Heights demanding a skate park for the area.
Mid-City Food Justice Momentum Team has worked for the past 3 years.
Your actions have resulted in change.
This is so much more than a conversation about food.
We know that we have to work together. It's about values.
Bringing residents, youth, agencies, and organizations together and then starting to make change happen in our communities.
Please help my community become a better, healthier, safer place by passing these ordinances.
We had a really strong, robust health and wellness policy that ended up being used and modeled in other districts.
Things can change, but you gotta act to make the change.
Health starts in our minds, in our hearts.
I have learned the rules of Richmond, but I refuse to play by them. I refuse to accept that this is just the way it is.
There's been a huge win at the Oakland Army base that is going to result in hundreds of jobs for East Oaklanders.
We want this ordinance passed now.
Today, we made history.
We did it!
It's hope. Start new. All over.
Together, we can build a healthy community.
We may not have money, but we have people power.
You go, BHC. One person inspires the next.
One wing builds on another.
Okay. Well, there's obviously a lot in all of this. So, I was going to start with a question about, from our partner's perspective, what are the critical resources that you need in order to do the kind of work that you see as most important in your communities? I mean, when you're talking to, actually, I'm not entirely sure who all is in the room, but you're talking to people who are in academia, you're talking to people who are in philanthropy, you're talking to people who work for large healthcare institutions, you're talking to people who work for presumably some advocacy organizations. What are the kinds of resources that you see are necessary for those kinds of institutions to be able to bring to community in order to partner in a meaningful way?
I'll give, maybe I'll share a story, an example of actually our partnership with the School of Public Health at Berkeley. So after about 5 years in operation, as we were seeing and understanding, what was going on for young people coming into RISE, so really serving as first responders for multiple kinds of violence and trauma going on. We kept going to the city, to our systems, just saying, like, here's what we're seeing, here's what we need. And what we would get back is, where's the data? We would show kind of data from either like a decade ago or from other places, saying, like, we can relate to we can relate what's going on here, and those aren't our kids, those aren't our problems. For those who don't know, Richmond, we definitely, we are overshadowed by Oakland and San Francisco, although we experience similar kinds of issues going on. So there's also very much a distrust and mistrust of anything that comes from any other place. So what we decided was, well, then we have to collect our own data. But we knew that we needed to do it in a way that was rigorous enough to have those, even, those of us in this room and outside of this room feel like it was legit. It needed to have a kind of design that would speak to the kinds of ways in which dominant public health, social science, social services will pay attention. That said, we also knew it needed to stay community engaged. It needed to be really done from a place of healing and trauma, so the process of inquiry and research itself needed to be healing and restorative. So I'm sharing all that to say we were really fortunate to partner with the School of Public Health at Berkeley in a way that really shifted ownership of data. So we did what we called our listening campaign. We talked to over 500 young people about their experiences of violence, trauma, coping, and healing. And our work with the School of Public Health was to have enough of sort of consult on the design, on the analysis, on the coding, but really with an understanding that they were playing a role to support our leadership and our advocacy in using the data to push the systems and conditions. This is a really different way for a CBO to be in partnership with academia. So there was no money. I think I went to a few of the classes and spoke a few times, but it was really about cultivating a relationship and having some hard conversations about the white grad students who really wanted to go talk to the young people. And I was saying, yeah, that's not going to happen. And here's why. But here's what we think is important as you go about helping a code, helping us to sort of set stuff up. Here's why this is important, and here's what we think you can do. It's up to you. So there was no exchange of money. Although money is important, I'm not going to not say it's not, but I think it is about what kind of relationships are we in with each other that's not dependent on an outcome or a deliverable, and that there's a lot of unknowns. Are we willing and able to actually step into those kind of ambiguous relationships that we think can be grounded, though, in trust and healthy struggle?
I think my mic still works. Or not anymore. So I think I have to agree that it's not always about resources, but a lot of it is resources. And as I mentioned before, given that we're in the middle of this, billion-dollar industry, there's not a lot of investment in the work that we do. And I think that as we're talking about resources, it's really investing in those with lived experience. I think there's a lot of risk that is taken to do that. But as we keep mentioning, those that have the lived experience are the ones that know the solutions to the problem, that it's their everyday lives. And it's not only just about saying, like, here's this pot of money, take it, do something with it. But it's about building the capacity to do that. A lot of organizations in East Salinas are emerging organizations, organizations that did not exist before BHC, but we have seen tremendous wins with these folks in these organizations because they are grounded in lived experience. And so it's about investing in taking the chance of those that are from the community and that know the solutions, but also investing in their capacity to lead. So really investing in what it is to start a new organization, what it is to do grants, what it is to do all this work in order to have something sustainable beyond the initial pot of money.
Okay, so I'm hoping there's some audience. Yes, thank you.
I think that that's an unusual thing for
and
me.
If you can introduce yourself and give a little sense of where you're coming from.
Sure. I'm Dori Escobar with a new initiative called Co-Action Institute that I started. I have a history of several decades of being a community organizer that somehow ended up as a senior leader in the health system for 13 years because it was kind of a radical group of sisters that started that system. I've since left, ended up going back to my passion, which is being closer to the community. And the IRS can do what they want with their tax code in the 990. So my question is about the sustainability of those kind of resources that you were talking about, and resources including, most importantly, the people. The Cal Endowment is a unique external partner in that understanding how the system works. You understand the need for long-term external investments. During those 10 years of investment, you guys on the ground have to build the kind of relationships where local financial and material resources are invested for the long term to keep it going, because community building doesn't stop, capacity building doesn't stop. These emerging organizations and leadership driven initiatives will spark new ones. And so how are you getting those local investors to build on what BHC has started?
So I think what we're doing in East Salinas, there's a couple of things. One is changing the narrative, right? Talking about this health department person. And we're actually, we received a small amount of funding, but it's still some funding, and it's actually demonstrating the value that we have in the community. And the health department sees the value we have, and they cannot imagine a world without BHC, at least there in East Salinas. And we're actually a part of a CDC, some CDC funding to do for the next 5 years. So 1 year beyond BHC at least we have. But it's a small funding, but it's getting systems to see the value that you have and to acknowledge that. And we have we were also going into grants with the city of Salinas to do community engagement, and so being intentional about applying for things because they see the value that we bring. And then some of the bigger work that actually has been happening with our program manager from the California Endowment is having conversations with those local funders, those that are doing the service-based models and are putting band-aids to solutions to things that are happening. And she has actually done a lot of work around having them address also the structural racism. They are part of that structural racism, right? And so it's them realizing that their funding strategies are not doing any good, right? It's that white middle class trying to just figure things out and doing some charity or whatever that looks like. And so it's really about shifting the way that they think so that they look at it through a structural lens and realize that they need to align their strategies if they actually want community transformation.
I'm Judy Nightingale. I am overeducated, white middle class, but my role is in Riverside County, the director of the Population Health Department, newly formed as of a year ago. My question for you is, over the past year, I have been out in my county where our majority is minority population of Hispanic, and I am wondering, I hear you loud and clear about me not being the right person to go out to find the correct resources to empower and build a better community for our people that really are disenfranchised and need that. My question to you is, who are the best partners that you've found in your work as you've been effective in this effort?
All of us are responsible, so none of us are outside of it. I think naming our own positionality is really critical too, so I appreciate that that's how you started. I think it's important for white people to talk to other white people. For sure, those spaces need to happen. For us, you know, we're built on cross-sector partnership. We rely on it. Like I said, the healthy struggle looks like, how can I make sure that I see your humanity, you see mine, and that the work we're doing isn't at the cost of either. And so in our relationships with everyone, that's how we approach them. And they're hard. And so what we need is folks, whatever your social positioning is are you committed to the struggle, to the messiness, to feeling uncomfortable, to feeling angry, and still committed to being in it? That's the piece of it, and committed to doing our work so it doesn't take away from, you know, everything. So much of what we do is to figure out how can we take care of white people, right? Like, and for people of color and for structurally vulnerable communities, we internalize that. So then we end up doing that. Mm-hmm. So our work then together is, how do we shake that up? And that is shifting the narrative, that is normalizing the conversation, that is, I might feel triggered and tender by, you know, something that someone says, but I am still committed because I know you're committed to my humanity.
So I had a question, though I'd love more discussion on the point you just made. But, oh, I'm sorry, I'm Phyllis Meadows, and I'm with the Kresge Foundation. And so this is more of a structural question because, first of all, thank you both for just a wonderful presentation, very, very inspiring for me personally. But I'm just curious, structurally, you're doing very interesting things in communities across California. Are there opportunities, or is it realistic, given some of the unique contextual issues that you may have in your various sites, are there opportunities to, or have you done, brought together some of the areas which you all share so that you can leverage maybe some of the policy advocacy work that you're doing? Has there been, am I making that clear? So has there been an opportunity across the communities to sort of come together strategically on some health issue that could be addressed at not only at the local level, but perhaps at the state level?
I should just very briefly, I didn't do a good job describing the structure of Building Healthy Communities, but Building Healthy Communities is basically, it's got two main components. It's got 14 local communities that are working on local issues primarily in a framework, and an environmental change framework, which the three primary components are neighborhoods, schools, and what we call prevention, which is really human service systems. So it's criminal justice, it's healthcare, it's social services. So that frame is consistent across the 14 places, but the other half really of building healthy communities is a sort of a statewide and regional policy change infrastructure, media narrative change infrastructure, which intersects with what's happening on the ground. So there's this sort of bidirectional flow of both learning, knowledge, and then the implementation of statewide policy. And so if we had more time, I'd give you some examples of that. But
I also have like a more of a local example to share, but it certainly is connected to our work as a BHC site. So the listening campaign, which I mentioned, we didn't prescribe what was going to come out of that. Our charge really was to listen, but listening with the intent to take the data and the findings to change systems. So we weren't going to ask young people about their experiences, what was going on, their challenges, and then say, now you need to change your behavior, right? So we were really committed to that. So part of what we did was we took the data and the findings as we were getting it, so we didn't wait till it was all done, and brought together stakeholders, CBOs, those who are part of our Healthy Richmond community, our public systems, and said, look, here's the emerging sort of findings. Let's talk about what it means. So the number one coping mechanism identified to deal with trauma and distress was smoking weed. We're the only harm reduction agency in town. And so if we took a behavioral intervention approach, it'd be like, well, we need to start funding weed cessation classes while we're building dispensaries in the city and getting tax credits for it, right? So that would be that shift, but ours is, it is the responsibility of everyone responsible for young people to meet young people where they are, that if we are getting funded to serve young people, then however they show up is how they show up, and we need to rearrange around that. So we're actually working with some of our partners who have been a part of the series. So we've done all these learning series based on the data to say, how can we push right now our mental health system to actually take out the zero tolerance, drug-free zone criteria out of our contracts? I mean, we get money from them and we sign the contracts, but we are not a drug, we're not. So maybe that'll change at some point. But I just want to share an example of, again, using the data to really lift conditions, change structures and systems.
I'm Dave Kindig, University of Wisconsin Population Health Institute. Thank you both for really terrific, inspiring presentations. In the Salinas example, you often use, several times you use the phrase system leaders. And I just wondered if you could give us a sense of what the scope of those leaders are. I got from the flavor of your comments, it might mainly be government, but I don't know if that's true. And and you several times mentioned the wealth in the agricultural business sector in your community. I'm curious if you've had any successes there, or if they're part of what you envision as system leaders that you have to work with.
Not yet. That is the big elephant in the room, right? It's we're working to really improve the living conditions of our residents, and around just outside of Salinas, all these people with these big houses and these cars, and this wealth that's surrounding this area. And so when I talk about system leaders, I am talking more about local government. So talking about city, talking about county. I sometimes refer to them as the system in a loving way, but a critical loving way. And so, but the idea is, I mean, we're going to have to work with agriculture. It's a reality in our specific community, and so we're not there yet, though. It's a monster of a problem. We have worked with some healthcare institutions. So within the county, there is a public hospital, and so we're doing a lot of work right now to get our undocumented population coverage. And so there is the Natividad Medical Center that is at the table. But we haven't worked as much with service-based providers, with some to shift kind of in their thinking, but we know that there's a need for everything. That you can't just tell people that are doing services to stop, right? And so that but as long as we all know what role we play in order to transform that.
Martha Gold from the New York Academy of Medicine, a academic activist, but is feeling the need to go back to become more grassroots. So that's my frame here. Andrea, you said something about going to the government and holding them accountable for what people need. So this is a bad time in terms of thinking about government, and I'm wondering what kinds of conversations are going on in your organizations. I mean, California, voted better than lots of the states, but what's going to happen if the government monies for the programs that are most crucial to us start to go away? Have you begun to think about what kinds of strategies are open? And it's to Tony as well.
I think it's the best time to push our government. I think it's because we are doing that role of humanizing ourselves, and it's about asking, there's all this that's happening nationally. What are you going to do here locally to make sure that we're not as affected? Where does your leadership rise here? And that's exactly what we're doing around this healthcare stuff. There is money. There's money being used in other places. They're being used more in incarceration. They're being used for things that they don't need to be spending on. And so it's about them looking at their budget again and figuring out where are they going to shave off to make sure that people's needs are being met. And so we are starting to have the conversation. I think it's an amicable but slight contentious conversation around healthcare, because that's kind of the reality of the nation. Something might change, and so we have to be ready for it. And so, but the great thing though is they are open to the conversation. And it's, again, I talked about that set core shared values, because it's always about bringing them back into the room and saying, okay, but if we're doing this, are we meeting the needs of our community? Are we really valuing their dignity and their lives? Or are we doing this to save the county money? And so it's about holding them accountable to those core shared values.
I'll share. I think, it is the right time. It's now just as ever, more than ever. For us as a youth organization, it's been really interesting, the conversations internally, that many of our young people, our young staff, have said, I don't feel any different since the election. So it's been like, stuff's been bad, it's probably going to stay bad. And so, and while we know that there's a pivot, a really dangerous pivot, elevated danger, I think for us, we have to actually hold, again, that legacy of what's already been bad. And so we have to do that while we're now responding to and figuring out how do we shore up our power, our capacity, our fortitude to deal with what's ahead with this regime. That said, this is the prime example where now our public systems, because now their lived experience is up for grabs, they are now saying, can we talk in a way that they haven't before? So we got it. We understand what that's about. That is exactly the legacy of who we center, who's the baseline, who matters. But our job is to take that opportunity and leverage it for learning, and now for figuring out how do we actually make sure all our lived experiences are visibilized and prioritized.
I was told that was the last question, so I don't know if we can do more, but just quickly, I'd love to if we can, but Martha, yeah, we're scared about what's coming down the pike. I think that, just to play off both of those responses, it's a balance. When we sat with the city manager of Salinas and worked through their budget, they showed us that 70% of their budget was police and fire. And at the county level, there's a disproportionate amount of those resources going to incarceration. So we have a campaign, our Schools Not Prisons campaign, which is about shifting the narrative and then shifting the investments that the county and city are making into young people and away from these punitive kind of downstream systems. So we're trying to, it's sort of a zero sum in a sense that we're trying to figure out how to better use the resources that they have access to. But yes, it's $20 billion to California a year just from the ACA. That's in jeopardy now, and those resources are critical. The expansion of Medicaid, as you know, well, in California has been huge. California's like literally a quarter of the ACA new population. So yeah, we're really frightened about this, but it doesn't fundamentally change how we approach these problems. We're approaching these problems through building power, in our communities, and we have results of that. We have 1 million people in California now in the criminal justice space who are eligible to reclassify their felonies into misdemeanors and no longer have to check the box when they're applying for a job or for housing. Mm-hmm. We have 250,000 undocumented kids that are now getting full scope Medicaid, Medi-Cal in California as a result of advocacy that humanized this population, put them at the center of our advocacy. We have, I mean, I can go on with this list. We have 300,000 fewer suspensions in California as a result of the advocacy done in communities like Richmond and Salinas to change the way school discipline policies are essentially carried out. That's a 40% drop in 3 years. So there are profound changes that are happening here as a result of the work that's happening in these communities and how these communities are networking their power to change state policy. At the federal level, we're in some trouble. California is moving this way, the feds are moving that way. There will be a big clash. How that shakes out, we don't know, but our goal is to slow it down, to bog them down with challenges, and to build more power. We're seeing, to some extent, this is a good thing for organizing. There's a focus now, and that's bringing people together across discipline, across geography, around a common set of aims. That's the gift for organizing. So, you know, it's a mixed bag, and we're afraid, but we're doubling down on our strategy. I want to thank our partners for this, because this is all about their work, their innovation, their creativity, and they're holding us accountable on our BS. So thank you very much.
So thanks for that great panel, and I am sorry to cut it off, but since we started a little late, we don't want to lose too much time. So I'll ask that you come back to the room at 11 a.m., and there is coffee out in the hallway. And also, if there were remaining questions, please write them down or talk to the speakers over the break. So again, we'll see you at 11, and thank you so much.